Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 28 new cases of COVID-19 in Windsor and Essex County. 11 are close contacts of confirmed cases, 4 are community-acquired, and 13 cases are still being investigated. We have had 15,596 cases since the beginning of the pandemic. 386 people are active at this time, and 129 active cases have the variant. 974 preliminary or confirmed variants of concern have been identified in Windsor-Essex County, with 91% of these cases having the UK variant. 2 cases have the South African variant, and 3 cases have the Brazilian variant. 14 people from Windsor-Essex County are currently in the hospital, and 5 people are in ICU. Our community has lost 414 people to COVID. There are currently 11 active outbreaks in Windsor and Essex County, 8 workplaces, 1 long-term care home, and 2 community outbreaks. Now for our vaccine update. 171,924 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 157,979 people have received at least 1 dose. Yesterday's pop-up clinics were well received, and we'd like to thank those of you who came out and braved the weather and the lines to be vaccinated. A special thank you to St. Angela Church Hall for providing the space for our community at such short notice. And a huge thank you to all of our health unit staff, directors, managers, and frontline staff from across all of our departments and all roles, including nursing, clerical, facilities, IT, inspection, enforcement, and HR. Our collective efforts were very well received, and we were happy to provide this service. In all, 1,104 people were vaccinated. 702 people received their vaccination at the St. Angela pop-up clinic, and 402 people received their vaccination at Mackenzie Hall. Overall, 80% of the people vaccinated were between the ages of 20 and 39. Windsor-Essex County residents 18 years of age and older living in a hotspot postal code are now able to book at 3 of our vaccination sites: Windsor Hall, the Moy Clinic in Windsor, and Nature Fresh Rec Center in Leamington. All 3 of these sites are located within a hotspot postal code. The postal codes include N8X, N8Y, N9A, N9B, N9C, and 8H and N9Y. Transportation is available free of charge if needed. Please call Bet's Cab in Windsor or Sun Parlor in Leamington. Residents who require wheelchair accessible taxi service can contact Checker Cab. And Transit Windsor continues to offer free rides for anyone going to and from a vaccination immunization site. The age limit across all vaccine sites is now 50 years and older. This is for the general public outside of those living in hotspots. Please visit wevax.ca or call 226-773-2200 to book your appointment. Please note that those in the first group of frontline essential workers who cannot work from home will be able to book their vaccine appointment beginning Thursday, May 6th. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us again today. Another successful day for vaccination in our community, and just like Teresa said, I want to echo my thanks to the community for showing up for these vaccine clinic despite the challenging weather yesterday, and we were able to vaccinate that many people in such a short period of time. This is a very busy week for all of our team with lots of vaccine coming in. So as a community member, if you are in one of these eligible groups, please go online and register yourself to receive your vaccination as soon as possible to make sure that we are planning appropriately and ensure that these vaccines are going into the eligible people as quickly as possible. I don't have much to add, so we'll just take a question.
We'll now take questions from the media. Today we'll start with Blackburn.
Yes, good morning. Noticing on your vaccine booking site, most of the appointments are booked up until Saturday. and some Sunday appointments are now available. When you open up on Thursday, do you intend to add more appointments? I know you always said you're only adding a little bit at a time based on availability, but you know what you're getting next week. So will you be adding more appointments for those people who will be eligible come Thursday?
We look at and monitor our appointments every day, and we will be opening up appointments spaces as we review everything. The essential workers will be able to start booking on Thursday, and will be able to access appointments that are available, but we'll continue to open up appointments every day. So even today we'll have more availability.
And also the Brazilian, there's now 3 cases of Brazilian. I know we've identified the UK variant before and the South African variant. Now that the Brazilian variant is in the community, can you tell people what the kind of the difference is? Have you noticed anything different with Brazilian compared to the UK or the South African variant? Has it been here before?
So I think you were breaking up a little bit, but if your question was what are some of the difference between the Brazilian and the other variants, is that your question basically?
Yes, that's my question.
Okay, yeah, so obviously it's one of the biggest issue is we know all of these variants of concerns have a higher likelihood of spreading it further into the community more than the typical COVID that we have seen in the past. So that's number one. The other concern that often come across is whether we are able to detect this virus using our traditional lab-based testing that's available. So obviously the Brazilian one we can also detect. The only difference it comes in when it comes to the effectiveness of vaccine. So that's something that they're still being investigated with all these Brazilian variants and people who are already vaccinated. So we have limited data which basically suggests that the effectiveness of these vaccines may be reduced for both the South African variant as well as the Brazilian variant. So that's why it's important that we get our vaccination number high and we give little to no opportunity for this virus to replicate or multiply in the community to cause any kind of variants or bring in any new variants of concern in our community. When more and more people are vaccinated, the likelihood of having a variant in our community will go down, and then that will keep everyone safe. That's why we keep repeating the same message: get the first vaccine that's available to you to ensure that you are protected and you're also protecting all your community members, and that we can get rid of this COVID as best as possible in our community.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Reflecting on yesterday's successes, do you think you'll hold more pop-ups, and do you think you'll be able to, noting that the resources were available to do it yesterday?
I think our staff were pretty motivated at the end of the day, and we heard a lot of positive feedback from these, as well as just from our own staff, and how they really felt it was very rewarding, and everyone came together, and everyone who received a vaccine were really appreciative. So we would like to offer more pop-up clinics, but as you stated, we're using the same resources for our mass immunization clinics. So if we were to do that, we would have to look at our current schedule for the mass immunization clinics and reduce a day there to offer other clinics, pop-up clinics in the community. But overall, we're really pleased with the results and the outcome, and I think the premise of a pop-up clinic really did work in Windsor yesterday.
For comparison, how many people can you vaccinate at one of the mass vaccination clinics in one day?
Well, it depends. We know that Windsor Regional Hospital is operating the Sportsplex, and they're able to do, they could do 1,000 people in a day, and The WFCU would be our next largest clinic, and I believe they're doing around 700 in a day. And then the other clinics are a little bit smaller based on, size and capacity to safely vaccinate. So, there across all of our clinics, there's good distribution, and a lot of people are getting vaccinated. And we also have the Moy Clinic where that people are getting vaccinated a couple hundred, almost 200 every day as well, 5 days a week. And in addition, we have primary care providers, and in the past we've had pharmacies and hope to have pharmacies again. So all of these channels of distribution really help to get out the vaccine and make sure that our residents have access to it in different ways. But the vaccine sites are, they can do quite a bit for sure.
How many primary care providers have been allotted doses in the region?
In our area, we initially worked with about 8 healthcare teams, and we have slowly been bringing on primary care providers. And I would say right now, and I could be a little off with this, but we probably have, because we have agreements, and I would say maybe 20 primary care providers.
Are they each getting different amounts of doses based on what they can handle, or is it a blanket number for each of them?
No, it'd be based on what their client roster is, the amount of people that meet the current age category and healthcare category, and what they can produce, safely vaccinate in their sites. So it is very individual, and some primary care providers have received AstraZeneca, and some have received Moderna, and as you know, we're receiving quite a bit of Pfizer. This week we'll be getting big shipments, and so the primary care providers will be using Pfizer as well.
Thank you.
Any questions from AM 800?
Dr. Ahmed or Teresa, I'm not sure who this is for, but yesterday for the pop-up clinics, workers in those postal codes were eligible to get the vaccine. But as of today and moving forward, it seems like workers in those postal codes, if they work in those postal codes, are not eligible. Is there a reason why?
So we're following the provincial guidance, and for pop-up clinics, it is for people that live or work in the area in one of the hotspot postal code areas. And on the booking system, it's for people that live in the area. So anyone 18 years of age and older right now that live in one of the identified postal code areas are eligible. And that's according to the provincial guidance. So the pop-up clinics have a little bit more ability to expand that with people working there, but not in the general clinics at this time.
Thank you. Dr. Ahmed, when it comes to the provincial guidelines for the vaccine rollout, can you and the team make adjustments without, I guess, permission from the province? The reason I ask, obviously on Thursday, there's a bunch of different essential workers getting them, but one is still grocery store workers, and we're hearing from grocery store workers, they're concerned. Some grocery stores are in hot spots. These employees are not getting vaccinated. Can you decide to include grocery store workers if you make that decision, or is that up to the province?
Well, Rob, the short answer is I want everyone to get vaccinated, and I think as we talk about one group versus the other, it's a comparative risk that we are talking about, and the comparative risk, there is always one argument versus the other, even within one group of people that maybe someone's or some particular workplace have a higher risk compared to the other. It gets really challenging at the population level or the community level to do those kind of comparative risk analysis. And that's why sometimes these provincial guidelines are important to have some kind of consistency in how these guidelines are implemented across the province. Of course, locally, we do have some of that flexibility, and we use that when it's appropriate, and it's fair and equitable and meets the ethical guidelines that we try to follow all the time to allow those individuals to get vaccinated. So we can make some of those local decisions, but it's not something that we feel that we should be making all the time. These provincial guidelines, these provincial priorities are there, and they are developed after several consultation and different levels of expertise come together to make those recommendations. So short answer, I understand there are people who think that they should be prioritized more than the others, but there are some reason and some rationale in how some of these priorities are developed, and we'll continue to push out the vaccine as soon as possible when we have more vaccine and when we are able to do the vaccination. Trust me, I want everyone to get vaccine as soon as possible more than anyone else.
Thank you. And one final one, just in regards to what you said earlier, obviously get the first available vaccine that comes your way, but obviously there's some confusion and maybe some anger out there after the NACI basically said they had preference for vaccines. Just want to get your thoughts on there. Do you think when they make these statements, these claims, that there's going to be confusion, going to be anger out there?
Well, I can understand that the messaging and how people interpret these messages are important. And if I look at NACI's statement, one of the critical things that they have always identified is the level of risk to you, and depending on which community you're living in, and depending on the level of exposure that you are potentially exposed to. And based on all of that, some of these recommendations are made. There were other recommendations that NACI made, that medical officers of health made, based on the scientific evidence and guidance, looking at our local situation. What we know in Ontario, the community spread, the transmission of COVID-19 is significant enough, and it is causing a lot of cases. It's leading to many hospitalization and people dying. And if we're looking at it from that perspective, then obviously you should get the first vaccine available. But when you have time, when your risk is really low, then you may have that opportunity to choose. And that's where the recommendations is coming from. And I can understand it may be challenging for people to understand that. What I can say, based on all the vaccines that is available, if you are at risk, get the first vaccine that's available to you, depending on where your community are. Our community case rates are still high. The cases in Ontario is high. So from our perspective, my recommendation would be to get the first dose available.
Thank you.
Any questions from CTV?
At this point, do we have any further details on possible sharing of vaccines with Michigan?
Not at this time. And as I mentioned earlier, there are some discussion that's been happening at various levels. I don't have any additional details or confirmation at this time.
Okay, also, now that the recommendations of the vaccine, that Pfizer and Moderna are the preferred vaccines to get, if you have if you receive the first dose of AstraZeneca, are you guys going to be considering the possibility of mixing different vaccines for the second dose?
Well, we know that there's been a number of studies and trials going on in different parts of the world, mainly UK, where they're trying to mix and match some of these vaccines. And the initial findings is pretty good, that people, if they've received a different vaccine, they can get another vaccine to maximize the protection. The complete results are not released yet, which would be expected sometime in June and July. And also the National Advisory Committee on Immunization is also looking at that data very carefully to make local recommendation. I can anticipate in the future that would be a possibility, but we don't have any full analysis of the data to make any recommendation at this time.
Any questions from CBC?
Yes, good morning. The total number of people vaccinated yesterday was around 3,200, which is similar to weekdays in recent weeks. Is that because resources were deployed to pop-ups? And I'm wondering, what do you expect the daily number of vaccinations to be on a normal day, considering that we have this influx of vaccine coming in?
I would have to look at everything and have to give you a better answer tomorrow, because we are ramping up some of the numbers at the vaccines, or at the vaccine sites, so to accommodate the extra vaccine. And so I need to kind of look at those numbers and determine the capacity at each of the sites. So I'll get that prepared for tomorrow.
Thank you.
Any further questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
Dr. Ahmed, just seeing the number of cases today, 28. We haven't been in the 20s, I think, for a couple of weeks now. I know you've been stressing the importance of following those safety measures. I guess when the community sees a lower number, obviously positive news, but keeping that message out there to continue to follow all measures.
Absolutely, and I think that's why when people are following those measures, that's how we drop the case counts. And again, this is just a single day case count. We have to have a pattern of seeing those lower case rates. And as I indicated earlier, we do have a great opportunity to, when these lockdown measures are lifted, when the stay-at-home order is lifted, our case rates in the community should be at a level which would allow us to open in a better state. And also with high rates of vaccination in our community, we should be able to feel much more protected and much more safe in our community. So definitely it's important that people continue to follow these measures, because that's how we can reduce the transmission. That's how we can keep our community safe.
Thank you.
Any additional questions from CTV?
Yes, are we getting any closer to booking the second doses, considering we're getting an increase of supplies?
Our second doses are scheduled for probably the third week in June. And I know that at Windsor Regional Hospital, their clinics are starting a little bit earlier with a lot less people. So they're starting, I believe, the first week in June with second doses. But the supply in June is hasn't completely been released yet from the province, but it will accommodate the ability to give second doses. So all of that is being planned, and we hope to give more information to our community in the coming days about how we're going to roll out these second doses. They will be booking online, but we will be notifying people by mail and other means to make sure they have the opportunity to book their second dose. So that is coming, and there will be vaccine for that.
Thank you.
Any additional questions from CBC?
No, thank you.
Thank you, everyone. Have a great day.